Okay, good morning, everyone, and welcome to 1 Million Cups Fairfax. We are excited to have our presenters today and have a little bit in common here. We just had a little chat. So let's get on with the show. The Kauffman Foundation works with communities in entrepreneurship and education to increase opportunities that allow all people to learn, to take risks, and to own their own successes. We'd like to welcome all the visitors. So if this is your first time, we would love for you to raise your hand icon. And then when you are called on, please share your name, your company, and how you heard about us. Donna? Looks like Donna's got her hand raised. Yes.
Absolutely. My name is Donna Ivey, and my company name is iCare, founder and CEO. I'm excited to be here. I turned 60 in less than a week, and I've had the company half my life for 30 years. And Ashley invited me.
That's wonderful. And Ashley, go ahead.
Great day. My name is Ashley Ivey. Company name is iCare Home Healthcare, and I heard about you all from Gresham originally, but then Dr. Josh did a presentation a couple of weeks ago.
Perfect. And then Tony.
Good morning. This may not be surprising, but I'm Tony Ivey with iCare Home Health as well. Ashley invited me. I'm glad to be here.
Thank you. I am going through some of the names here. Some of them that I don't necessarily recognize right off the bat, but I would love to hear from. Chanel James, would you like to introduce yourself?
Good morning, everyone. My name is Dr. Chanel James. I'm the owner of Limbs and Things Mobile and Telehealth Physical Therapy Practice. We serve aging adults in DC, Maryland, and Virginia, and I'm glad to be with you again.
Great. Thanks for joining us again. Dory, would you like to introduce yourself?
There we go. Good morning, everyone. My name is Dory Howell. I am a branding and business photographer based here in Northern Virginia, and I help busy professionals get the images that they need to promote their business and make more money.
Thanks, Dory. It's good to see you again.
Thank you.
Carolyn, would you like to introduce yourself? Carolyn Barbosa?
Oh, hi, guys. Sorry, I finally made it to my office. Hi, my name is Carol. I represent Seva Spaces. We're the newest co-working space here in Fairfax in Virginia. Just looking for networking opportunities and just getting to know what's going on in our county. So thanks for having us.
Thanks for joining us, Carolyn. Okay, next slide, please. Okay, so if you could check in on our website, 1 million cups / Fairfax, 1millioncups.com, sorry, / Fairfax, and check in, or it's much easier for you to scan the QR code. As you can see, 1 Million Cups does track the attendees, and that helps us with not only metrics and seeing how we're doing. We also get some of our 1 Million Cups swag to provide to our presenters as well. But that also lets us know how we can grow and how we can do better. So if you would please do that. Also, if you were here last week and you did not check in, you can check in, same with the QR code, so that you could be added into those metrics. We'd appreciate it. Next slide. So this is our organizing team and our brand ambassadors. As you can see, our organizing team gets together on Monday mornings for about 30 minutes so that we can get our admin out of the way and get our presenters ready for Wednesday morning. So we would love for you to join us. Our brand ambassadors, they assist us with speaking to the community and sharing about 1 million cups so that hopefully we will have presenters that we could help with their business challenges. Next slide. So 1 million cups is a national and local mission. We work towards this mission through creating consistent educational experience for each of the 1 million cup presenters nationwide, while also highlighting the uniqueness and the value proposition in each local startup community. So in various cities around the country, same time, same place, virtual and in person, 1 million cups takes place. Our key pillars here, presentations, not pitches, authentic connections, by not networking, although we sometimes do network afterwards. We are run for the community by the community, which means those of you that show up, we thank you for being here to help out with questions and comments to help our businesses with their challenges. And we are radically and intentionally inclusive. So we have our coffee sponsors, our space and our coffee sponsors. So for our space sponsor, on the first Wednesday of every month, so that will take place next week, we actually meet in a hybrid situation, so in person and virtually at the Mason Enterprise Center in Fairfax, not to confuse that with the new one that's in Herndon. We did have a couple of people that have gone to the wrong location, so it is the one at the Willowwood Center in Fairfax. And then Jen, would you be able to speak a little bit on the Vienna Oktoberfest?
Sure. This is just a reminder that if you want to attend the Vienna Oktoberfest, please do so. Vienna Business Association is a great group to attend events, consider joining. They were looking for volunteers. So if that's something where you would have fun volunteering, just something to look out for. If you do want to be a coffee sponsor for October, I think we are looking for one. And so you get to talk about your business for 2 minutes every Wednesday morning for the entire month.
Thank you, Jen. So how our meetings work, just a little bit of housekeeping. You guys know, or I assume that you know how the virtual meetings work. However, if you could please keep your microphones on mute. If you have any questions or participate in any discussions, use the hand wave icon. We will have a moderator who will call on you. And then please unmute, state your question or your comment, and then place yourself back on mute so that the speaker or the presenter can respond or ask further clarifying questions. And just again, just a little reminder for best practices and conversations, that, if you have a slightly different perspective, please say so instead of saying something like "I disagree," and then ask for clarification instead of saying something like "I don't get it." And we'd appreciate that. And with that, I'm going to turn it over to Ashley Ivey, and the floor is yours.
Wonderful. Thank you so much for having me here. I guess I will just say next slide when we go to the next one. Oh, not yet. Okay, I think I have it. Wonderful. Well, thank you so much for having us here at iCare. I appreciate the opportunity. So the reason why I wanted to touch on this slide is we are at iCare, we are celebrating our 30th anniversary. And what you'll see is there's a 3 in the heart. The heart has always been in iCare. We put the 3. So it's 30 to us, but we've been providing care for clients in the Northern Virginia area for 30 years and at their home. When iCare first started, we did a lot of physical, occupational, and speech therapy staffing services. So that's how iCare started, PT, OT, and speech. So that is in our blood. About 15 years ago, we started transitioning more to nursing and personal care services for clients because we saw they needed a little bit more care during the day. So while right now we do not provide PT, OT, speech, we refer to great practitioners. We have that background and that foundation. Just briefly, a little bit of what personal care assistance is. It is helping patients with their activities of daily living duties. So that could be getting up in the morning, that can be transferring from their bed to the commode, that is light housekeeping, light meal preparation, medication, reminders, companionship, having someone to talk to. So, and they also do a lot with safety, keeping the patient safe. So I've gone through that. So that is who eye care is. We have the foundation of rehab, PT/OT speech. We do not provide that right now. We refer out, and we do nursing and personal care services for clients throughout Northern Virginia and Maryland. We are recently licensed in the state of Maryland as well. All right, next slide. So this is the challenge question. What is the best way for us to promote our training program for our caregivers? I wanted to give a little bit more information about me. My name is Ashley Ivey. I have been working administratively for eye care for 23 years. So I'm 37, which would have made me 14 when I started working for eye care. So I got a worker's permit and a birthday cake. You work for the family company, and my sister and my brother, all the same. We all worked for eye care. So that makes me a little bit unique as one of the instructors of our personal care aid program. Number two, I'm a clinician, rehab clinician. I'm a licensed physical therapist assistant. I've been licensed in the state of Virginia for 13 years, and I've worked in hospitals, home care, assisted living, and nursing homes. Number three, that makes me really unique as an instructor, I will tell you later. So keep that in your mind. There's a third one that makes me unique as an instructor. Number one, I've been working administratively for 23 years for eye care. Number two, I'm a clinician of 13 years working in hospital, home, assisted livings, and nursing homes. And then the third one, I will tell you a little bit later on. All right, next slide, please. So our company was founded in 1993 to provide care for clients in their home. We started a training program to get more caregivers in the field in 2019, right before the pandemic. So we had our training program, our personal care aid program, and then the pandemic happened. And we put all hands on deck to care for our clients. One of the best things about our visionary and founder, Mrs. Donna Ivey, is that she's very forward thinking. And so she was able to get PPE, protective equipment for all of our caregivers and our clients. And what that did inside of eye care is that allowed us to stay viable. It also allowed us to help the community. During the pandemic, assisted livings were understaffed, and some of them did not have the equipment that they needed. So they would call eye care, our personal care aid company, to staff their facilities. We were able to staff the facilities because we've been in business for such a long time, and we had that PPE. We decided to pause on the personal care aid program during COVID. Now it's 2023, and we're going right back at it, even bigger and better than we did before. So we sold our first service. Let's say we're relaunching 2023 this fall, and we have a couple students who are signed up. Next slide. So one thing I wanted to talk about was the acronym for eye care. Eye care stands for I care about restoring excellence in healthcare. My mom made that up, and she created that in 1993. I care about restoring excellence in healthcare. And that is what we've always, that's our mission, that's what we strive to do. And so what better thing to do after being in business for 30 years, providing the care, but to train? So that is one of the transitions and the kind of the evolution of eye care. We continue to provide that personal care services for clients, but we want to train others in our community to be able to provide that quality care the way eye care does and has been able to sustain for 30 years. So our new training program will relieve the severe shortage of caregivers by providing this professional, comprehensive training to people who are looking forward to this to become a caregiver, to take care of their loved ones, or because they want to be an advanced healthcare, be an advanced healthcare practitioner. We can go to the next slide. How we generate revenue. Our program is $600 for the training. So it's efficient, It's a quick, low cost, high quality, practical training so that people can learn how to take care of patients in their home or assisted livings. One thing that I forgot to mention is in 2018, my mom and I were in the Washington Post, and they did a study, an HR study named Mercer did a study that said by 2025, the United States will need 400,000 healthcare practitioners in home health. Now that was in 2018. Can you even imagine what it's like now? And the blessing about eye care is that we've been in the industry for so long. We have our employees for eye care, for our caregivers. We are doing this for our community. We are doing this because we want to give more to our community. Just like I said, during the pandemic, our community reached out to us, to staff. We want to make sure that they have people who have the training and the heart for care. And so that is one of the reasons why we're doing this, so that other companies and hospitals have caregivers to help with this caregiver shortage. Next slide, please. Value proposition: we provide low cost, high quality, practical hands-on training developed by experienced nursing and a rehabilitation team. Eye Care's personal care aid program is the only program in the United States that merges nursing and rehabilitation. Nursing and rehabilitation. I have my nurse who has years and decades of experience in nursing, and then myself as a rehab practitioner. We do those together for specific reasons that I will go over shortly. Next slide, please. All right, who is our target audience? We have 3 of them. 1, people who want to get into healthcare. They have the heart for care, but don't know how. Maybe they don't have the finances to go to med school right now, but they really want to get that hands-on care and that training for and work in this field. There is a great need. Every single place. Being a personal care aide or a caregiver is almost recession-proof because there is such a great need. People are getting older, they're living longer, and they have more needs. Number 2, people who are a family caregiver that are taking care of a loved one, and they want to make sure they're doing it properly. They don't want to hurt their back. They don't want to hurt their loved ones. They don't know the ways to take care of their loved one and give them the dignity that they deserve. One of the most interesting things I learned in the hospital was how to take on and off someone's clothes with keeping them clothed, which was really interesting. How do you do that for your mom or your dad so that your parent has that dignity and that you can care for them. And then number 3, people who need the hands-on training for an advanced medical career. If you go to physical occupational therapy school, if you want to be a PA or a nurse, a requirement on your application is that you have hands-on experience and training. And so that is what our personal care aid program can give for people. So those are our 3 target audiences. Next slide, please. Okay, who are our competitors? I want to talk about, I'm going to go from the 3rd one to the 1st. YouTube. YouTube. People say, hey, I don't need this training. I can look on YouTube, and YouTube has training for everything. One of the things about YouTube is it's great to teach you how to fix a bike, but how does it teach you patience? Patience with a patient who has dementia and you're trying to feed them. What are some strategies that you can do that even though they're not trying to open their mouth, that you can learn how to do that? That is what our training program does. It gives you that hands-on experience, and you're able to use real people. In our school, we use Charlie back here, who's our mannequin, and then we also use each other so that you can learn in a real life situation how if you have an easy chair or recliner that is next to the bed, how best to transfer them with a walker. Those are things that you can't, it's really hard to do on YouTube. I forgot to introduce this room. The room that I'm in is actually not my living room. It's in our office. It is one of our training rooms so that our caregivers, our applicants, for our school, our students get the hands-on training. So this is right in our office in Ashburn. It has everything was set up with intention. by our rehab team and our nursing team. So we have a recliner, we have Charlie in the bed, all of his, you can do range of motion on him. And then we have where his clothes are. Charlie turns into Charlotte with some things that we have in the drawer so that our caregivers can learn hygiene care for clients. So this is the difference. Other than YouTube, you get the hands-on experience in here. Another competitor is to do nothing, is to say, hey, look, I'm just going to figure this out as I go. I've been in healthcare long enough to see an unfortunate trend. And this trend tends to be sometimes, family caregivers who love their loved one and want to provide the care, but they don't have the training. And that family caregiver ends up getting sick or passing before the person they were taking care of. I have seen it time and time again. We had a gentleman who was taking care of his wife who has multiple sclerosis. For so long, he ended up getting sick. And right before he passed, he called us in to provide the care for her. How much better can the quality of life be for those family caregivers when they bring in a personal caregiver, or they get the training themselves to know how to lift someone up in the bed, how to help them with their hygiene, how to feed them, how to take care of themselves. That is one of the things that is in our personal care program, how to take care of yourself, even though you are caring for someone else. So that is how I saw that, the competitor of the do nothing. I also do a lot of training on my families on taking breaks and getting other people involved. And that's something that we really focus on, because caregiver burnout is a real thing. It's a real thing. I had a patient one time, the mom had dementia, and I went to the client's home. She was living with her daughter, and her daughter had been taking care of her so long, her daughter no longer called her mom. She called her the dementia patient. And it was hard for me to hear that. And at the same time, I recognized that, she's doing a lot for her mother and whatever I could do to help. So in our third competitor is Moon River School. Moon River does provide personal caregiving. And so I was challenged to kind of look at some things that make us different. So they provide nursing, home health aide training, and personal care aide training. I want to talk about something that is very dear to us. We like to golf. I don't know if anyone else likes to golf. Anyone else? Can I see some hands? Okay. So I am just starting to learn how to golf. And for purposes, I brought my golf club and a ball. And one thing that is really cool about golf is that you always get a second chance, and there's always things that you can learn. And, I am learning about par. And par, PAR, is being able to hit the ball in a certain amount. Every hole has par. So if it's par 3, you want to hit it in 3 times to be able to get it in the hole. So we have in our program, because we merge nursing and personal care services, we train our caregivers to aim for par for their clients. PAR for us is prevention, adaptation, and restoration. Prevention, adaptation, and restoration. Because we merge nursing and rehab, we help with the prevention side. Our caregivers are able to see the origin of where people are injured at their home. So picking up those rugs, our caregivers are able to, they learn that. How do you prevent someone from falling? Adaptation. When someone comes home with a new mobility status, because they have the rehab training as well, they can help their patients adapt to those things. That yes, maybe you can't do exercises on your bike anymore, but you can do a couple ankle pumps at the countertop, or you can do something that's a little bit more safe, seated. That's what our caregivers learn in our program. And restoration, because our program is nursing merged with rehabilitation, they learn how to do range of motion exercises. They learn certain exercises that they can help their clients with, so that when the clients stand up from laying down, they don't have orthostatic hypotension and get faint. That is something that makes us really, really unique, that merging of the nursing and the rehab.
So Ashley, if we can wrap up in the next minute so we can move to questions, that would be awesome. This is really helpful insight. Thank you.
Absolutely. Next slide, please. All right, how may we leverage our competitors? For Moon River, we would just lean into our family caregivers, be able to give that training for them. YouTube, we can use YouTube, which we do. We use that as a portal so that people can get some information. And if they want that hands-on training, they can come into here to our facility. Next slide, please. So, challenge question. What's the best way for us to promote our training program?
Outstanding presentation. This is Melinda talking, and I am facilitating the conversation today. Please raise your hand and or put your question in chat. When you do that and we call on you, please be courteous of everybody else and only ask one question. You can put your hand up again, but don't do a continuous amount of questions. And Ashley, if you already are aware of things or whatever, just say thank you, next question, just to move on, just for the next person, or I love the idea, let's talk later, or whatever you need to do. Starting with wow, we've got 4 people already. I've got a bunch, but I'll save my stuff for later, because as you know, I'm a new caregiver, and you said a lot of things that push my buttons. I'm going to start with Dory, who I've known in my past as well, and then Ken, and then Jen, and then John Foster.
Ashley, thank you so much for being our presenter today. As someone who has had to hire caregivers for my mother and is looking to have to do that probably in the very near future for my father, this definitely resonated with me a lot. And I think that as someone who was looking to hire a caregiver, there might be a way for you to connect with people in my situation of $600 is a lot for a caregiver, because we know they don't get paid very much at all, to pay for a course. But I would pay for that for an employee who I loved and who took great care of my loved ones, so that they could be better trained. And in hiring caregivers in the past, there were a lot of things that, first of all, they weren't paid very much. They were inconsistent. They were through an agency, but I could tell that they would be ready to jump ship at any point in time. But if I had found a caregiver that I really wanted to invest in, I absolutely would have paid $600 for them to become better trained. So that might be something that you guys would want to investigate, that you can partner with other people, but also there are people like me that would pay that and want to, for ourselves and also for other caregivers, want to be better trained in how to take care of our loved ones, because it is such an incredible, emotionally and physically taxing job. So those are just my 2 cents. I have some other ideas for you too, but maybe we can connect offline.
Okay, Dory, that was excellent. Thank you so much for letting me know. I will give you a little bit of information. So in the state of Virginia, all caregivers that work for agencies must be licensed as a CNA, or they have to get certified. Unfortunately, what we have seen is a lot of companies come without caregivers that are licensed by the state of Virginia or certified.
Yeah.
And so on the other side of looking for home care companies, you want to make sure that they have that certification or that license. But we see tons of home care companies coming up, and they don't, and because the state is so bogged down with so many companies, they can't check to make sure. But absolutely, if someone has a personal care aid certification from another company, they can always become certified with iCare. But that's a great idea to talk to the families.
Okay, next we've got Ken, Jen, John Foster, John R, and that's it.
So Ashley, I hope you guys can hear me. Your enthusiasm and your experience and your background have contributed to an awesome presentation. Thank you so much. This is a sort of standard marketing program. Who are the people that you want, and where do they hang out? So, for example, if you're looking to find people who need work, I'm affiliated with an organization that does language training.
Oh, I think I lost you a little bit. Either I'm
The question
frozen-
is, what do the people you're looking for look like? And where do they hang out?
Very good, very good. So if I focus on one group where I would like to focus on is the family caregivers. The people in the home that are taking care of their loved ones, and where those people usually hang out or where I could find them is church organizations, sometimes, and that's a good question. Some church organizations, like if I give speaking engagements for seniors, that's where they hang out. The thing about going for people who are just looking for a job is that healthcare isn't just a job. People often ask me, you know, how's work? And I'm like, what are you talking about? Because healthcare is my life. I've been doing this. I care for others all the time. And so I struggle with going to people who are just looking for work because healthcare is hard sometimes. Taking care of someone that is sick is not the easiest thing to do. And when you have that experience and that training, it makes it easier over time. So that's a great question. And I will continue to work on that. For the family caregivers, I'm looking to have speaking engagements at churches. We're doing one at River Creek, a couple of assisted livings as well, so that the families can help. And it also gives them, just like this did, it gives families more information on what to expect when you have a caregiver. So now that you know caregivers have to be licensed or certified in the state, now you know the company that you're with, you need to make sure that they're licensed or certified in the state of Virginia. So that's a great question, Ken.
Next, we've got Jen, and then we've got both Johns.
Hey, Ashley, great job presenting. I love seeing the family business and everybody represented here. My thought would be, this could be a very interesting benefit companies could cover for their employees. The trick there is that people are stuck between a rock and a hard place. They have a job, then they're a caregiver and all that, but at least this training might help them be less stressed, be more educated, and be able to be more successful. So I might think about connecting with HR leaders, with people who are trying to redesign or rethink benefits, because that is something that I think could really go a long way for talent retention, and for companies just to acknowledge the stress and pressure that their employees are under and that they're there to support them. So just something to think about from a benefits coverage standpoint. And then, you know, if an employee didn't want to be trained themselves, to your point, maybe they have a family member that could be, or maybe they hire iCare to help on the care side.
That makes so much sense, because the employee retention, if your employee is lifting her mother up in the bed improperly and is hurting her back, and is now, I mean, back problems are probably one of the reasons why people, you know, don't go to work. Most often is because they've hurt their back in some kind of way, but then they could keep them at work if they have those strategies of how to move the person in the bed, or if they hire a personal care company. That's great. I'm taking notes, by the way. These are amazing. Thank you guys so much.
This is recorded. So yeah, as long as we're keeping our answers and questions short and concise, you'll get a lot of great ideas.
And it's in the chat as well. We've got the two Johns, and then I'm gonna spill out a couple of my ideas.
Great, thanks, Melinda. Ashley, it is great to finally meet you. You and I have gone back and forth for several months, but it's great to meet you and love your presentation. And congratulations to your company. You guys are just doing unbelievable work. My question just around the training, the price point. I don't know, is it from a profit standpoint? I'm just kind of curious as far as what that training looks like, and from a profitability standpoint. And then also going back to Jen's point about the benefit, have you guys looked at you being able to use this as a flexible spending account expense?
That's good.
Yeah, that is. Quick question. Your question about $600, the price, is it a profit? Can you say that one more time, please?
Yeah, just as far as the profitability, and I don't know how that training is done. And then is it a profit center? Is it a loss leader? Is it another way to find people?
Very good, very good. So well, let me let you know. So personal care aides, after they have that certification, they can work in the state of Virginia as a personal care aide in home health or some assisted livings. From that, you can also become a CNA, a certified nurse assistant, and get your license from the board. The personal care aide program is a 40-hour course. CNA is 140 hours. So with the CNA class, that's $3,200 up to $3,700 for students. The PCA program is $600. And with that PCA program, you also, for our program, you get CPR, AED, and first aid training together. Our course is 40 hours online, and then they come into our training center and they are trained by me and our nurse in skills training. Once they've been checked off on all of those things, they would have a certification and can work in the state of Virginia. So that is, in terms of us in business, iCare doesn't really need any more employees. We're trying to send people out and help in the bigger arena of having less of these hip fractures. And I used to work on the hip and knee floor at Virginia Hospital Center. And just to see that one thing, one rug, one person who doesn't have a grab bar in the proper place has a hip fracture, which increases their dementia, so we're trying to help on the prevention side. So I hope that answers your question for iCare as a business. Yes, it is profitable. I train, our nurse trains, but the course is online. And then they come in here. So it is very profitable for us as well.
I'm
Great
gonna
question.
have Scott go before me, but he just disappeared. So I guess I
How about
will.
John R?
John
Oh, John R. I'm sorry,
somehow my
John.
hand
I'm
was
sorry,
down,
John.
but
I'm sorry,
no
John.
problem. Hey, Ashley, phenomenal presentation. And so I want to first congratulate your parents, Donna and Tony. You must be not only remarkable in business, but as parents, you clearly did a lot of good things. And based on Ashley's presentation, your children must be phenomenal. And it's so cool they're in the business. So yeah, congratulations, guys. So I want to focus on your challenge question, which related to training people. And training's a product. Okay, so let's talk about delivering a product. Well, why the heck should I take a training course? It's boring. Oh, but you talked about really important things like the dementia example you gave, transferring a patient or changing that patient's clothes. So all of a sudden that relates to how you market, but really, why should I take that course? But then you spoke about the different certifications and what's required. Okay, well, that begins to encourage me, but then I don't have a job at the end of that. So then I need a job at the end of that. So maybe they do come to work with you as they journey into their career, but maybe there's state or federal funding for these, no different than I had a client, they were Diesel Institute of America. They taught mechanics and all of their funding was federal. So if there's such a need, and again, I don't know what programs do and don't exist. And I don't know what church groups could fund for some of their congregants, an advanced program that promoted them. But finding the funding sources, asking the questions, why the heck should I take your course? And answering the questions of who is the likely person to take this course? And finally, part of what you're doing is you have a social conscience and feel a social responsibility. And part of it is a business goal. And so I don't know enough about your pricing or financial model or your overall motivations. But if your corporate responsibility is really the strong one, then lower the price to $449. It sounds a heck of a lot more affordable. Thank you, guys. Amazing.
Okay, thank you so much. Thank you so much for that feedback. That's awesome.
I'm going to jump in and then I'll call on you, Ken, again. I wrote down a bunch of stuff and I'm going to start with the eye care support groups and training. One of the pieces of low-hanging fruit to me, and as I mentioned, is I am part of a caregivers program right now for caregivers for my husband who had a stroke a couple weeks back. And it's really interesting how this program works, but the way I'm seeing it is, number one, I need to give you an introduction to Johns Hopkins and this support givers group, because that's the low-hanging fruit I see. A lot of hospitals have programs for the caregivers. And if we can get into some of the big hospitals around the country, it's going to be really helpful for them, because I got thrown into it. I don't know what to do. I don't know where to go. There are a lot of issues. We can talk about that later. Saw on I guess it was the Today Show the other day, and they were calling the family members partners. So caregiver partners. I love it. I tried to steal it for the other, but I think that's a partner program, and it's a natural wording that you can use. And I'm seeing that you can offer things to the partners. The other place you're going to find it is from the doctors themselves, the neurologists, the cardiologists, and all the folks that see stroke victims are the biggest probably contributor today into caregiving, as well as Alzheimer's and a lot of other things. But with the stroke victims, there are different types of care they need. Like my husband he's fine physically, other than he can't see, which is awful, and his brain is not working the way it used to. But I don't know what I should be doing. So there's a lot of stuff in there. I also wrote down, because I've got a lot of other things, and I will make sure I find them. I circled it so I can find it again. When you were focusing on family for caregivers, I love the churches, the speech engagement, and the seniors, and there are lots of associations and things that you can go to get to a lot of these different groups that we can help you find. But as I said, I think the low-hanging fruit right now to me, and where I can help you, is with the hospitals and the introduction to a big hospital like a Johns Hopkins that may be able to help.
Okay. All right. Well, thank you so much. We appreciate that.
Next,
Great
we've got Ken.
Yeah.
And I'm going to bet.
Ashley, I had an idea. I'm not sure it's a good one, but rehab facilities are discharging people to their families. And my understanding is somebody in the rehab
We lost you there for a second, Ken.
we're going to have to talk to Verizon about this. The people who are releasing folks from rehab facilities have to make sure they're going into a safe environment. And it seems to me that at that point in the conversation, you want to have your trifold pamphlet on that person's desk.
That's an awesome. Can I talk about that? That's amazing. I used to work at Virginia Hospital Center, like I said, and so I was on the hip and knee floor, but I often went to 7, which was neuro, and we were the people responsible for. Well, we would recommend what we thought, recommend where they should go after the hospital, the therapist. And so back then, 12 years ago when I was there, I mean, it was, subacute or home with help and things like that. Now what's happening, because we know some discharge planners, is that there's not enough companies out there that have caregivers, and so, or rehab staff. And so they're discharging people home and saying, hey, hope you do well. And so that's a really, really good point. I like that, really, in giving that training for the family members. People who are trained in business, sometimes they don't know how. I mean, you're trained in business, but you're not trained in, how do I take the bedpan out off of mom without spilling it in the bed? So that's a really good idea, to talk to those discharge planners and being right there to give that training.
Next, we have Jen, and then we have John R. And there we go. Jen.
Thanks, Linda. I'm not sure if this is mean, it's more an affiliate marketing, but for anyone who's moving their parent into their home, who are the people that they would be reaching out to first? Organizers, movers. It could be estate planning folks, they're updating their documents. So I would think about a targeted campaign to organizations that are going to know about this need before you might know about it. Therapists might be one where people are talking about the stress they're facing. So I might think about who are those top partners and just letting them be aware that it's a service that you provide, because they can be marketing on your behalf and sharing that out on your behalf.
Very good. Very good. That I love this. This is really good. One of the things that I think you all are getting, but I didn't quite say, is that there is not going to be enough caregivers. Right? There's not. And because of that, people are having to take care of their loved ones. And they're doing it the best that they can. And so what we're trying to do is, we're trying to increase how many people are getting in the field, but then we're also giving the structure and the training for the people who are right there to be able to care and to love their loved ones for who they are, and to not see them as a patient. But that's a really good point. Oh.
Okay,
Next,
so
we've got John R. and then John N. And then
so again, love listening to everyone and hearing the challenge. And if I heard correctly, your challenge relates to providing training, attracting people who want to take training.
Yes.
To get into this great field, which is exploding, or the demand for service is exploding. So am I correct that your folks have been through the training? Anyone who works for you. So from a pure marketing point of view, you can get videos of them and get a 10-second clip of how important it is, because you want to hit both the pain points that the patient is going, or the child of that elderly person. Okay, that 55-year-old who is fearful of dealing with the parent, who cares about having a caring caregiver, a professional. You want to train that professional. So if there's so much business out there, then the next 20 people who come through your program need to go to work for you, which is the greatest testimony to creating a training program, which again is just a product. Okay, so in order for someone to want to do it, they need a career path.
Yes.
Even if they don't stay with you forever, but if the demand is there, then most people have been focusing on the business of caregiving. And you want to be in the business of training for the moment.
Mm-hmm.
Okay, so you have to both pull on the purse strings, use the testimony of your folks who've been through the training and who are living the examples and soothing the pain points of the children of the elderly. Okay, and maybe that works on both sides of the house, but if you're looking to attract trainees, students, then offer them a career path initially.
Yep.
And by the way, at $1 an hour over 600 hours, you just funded the tuition.
Right.
Okay, so maybe you only fund half because they should have skin in the game, or a third. Or it can be FanDuel, bet 5 and get $200 back.
But something that shows, so, and that's what's really interesting. Someone had brought up earlier also is that the caregivers don't, get paid, enough. And I totally agree. The thing is the pandemic changed that. So prior to pandemic, caregivers were making $10, $11 an hour. I have caregivers right now, personal care aides, that are making $25 an hour. And so from a career standpoint, an investment of $600 in essentially 2 weeks of your time, you can come out making $2,500 to $3,500 a month. That's not even including any overtime in a high demand industry. So I love what you said, John.
Okay, good.
Before we go further, we're up to 9:50. We've got John Norris' story and then the last question by Jen. But if you guys could keep your questions or comments short, that would be helpful.
Hey, Ashley, I work in the Medicare space, so I understand exactly what, the challenges are from all the perspectives. I just wanted to share with you that there's at least one local company, Medicare Advantage provider that does provide caregiver training. It's telephonic, but it does allow a family member or a friend or a loved one to call in for, I guess, guidance and assistance. I know you're aware Medicare doesn't provide for coverage for activities of daily living. Obviously, skilled care we know is covered, but interesting trend. I didn't know that there were companies like yours out there doing the training for those caregivers. It's obviously good for me to know. Sadly, when families face those challenges, but great mission. Loved hearing what you're doing and keep going.
Thank you so much. With that, thank you, John. With that, I was hoping, and maybe Dory's going to mention it. I had said that there are 3 things that makes me unique as an instructor, and I did not give you the third one. So the first one, were you going to say that, Dory? Oh, okay. So the third is that I have been a patient of eye care for 19 years. I have actually needed the care. I have multiple sclerosis. For 19 years, I was diagnosed my senior year of high school, and I've been in a wheelchair. I've used a cane. They told me by the time I was 28, I wouldn't be able to walk on my own. And so that's unique because I'm the patient. So when our students come, I can tell them how it feels, to have your independence taken away from you. I can say, how does it feel when your mind is there, but your body doesn't work? How are you able to be sensitive to someone in that situation? How to do rehab for someone who feels like the doctors are saying that they're not going to get better, how to still give them a smile and hope. So that's the third thing. I just wanted to mention that.
Wow. We got Dory next.
Great. Ashley, there's a couple of resources that I think would be really helpful for you to kind of crowdsource information, especially for things. I think there's a real need, going back to my original point, of people like myself who want to hire, who might be looking at needing to care for someone or something in the near future. There's a Facebook group. What you've probably heard this term before, and a lot of us are probably fitting in this category. I'm a member of the sandwich generation, where I have older parents I need to care for, and I have a younger child that I need to care for. There's a couple really huge Facebook groups out there that talk about their trials in caregiving all day. That's what they talk about, is how much trouble they have. And it might be a good idea to get someone on your team just to go into those groups. And if you want to contact me privately, I can give you the links and so forth, to go in and just kind of see what people are talking about. It would probably really help your marketing message when it comes to, if you want to go into attracting people like myself. The other thing I'll mention really, really quickly, you have an absolute perfect idea for an online course. And I have made millions in online courses. If that's something that you want to talk about, we can do that offline. But you have the foundations of something that could really go very far. So just putting that in your head. Lots of people can help you with that, but I can help you as well. So anyway, thank you so much for your presentation. I know we got to go.
Yep.
Thank
It's
you.
up to Jen.
Well, Ashley, hopefully you've gotten a lot of ideas and insights. Is there anything else our community can help you with today?
This is great. What you can help me with is, do not be a stranger. Please reach out to me on Facebook or LinkedIn. Please keep giving, looking at what I'm doing. I have one brain with a couple different thoughts, but here I have 19 brains on here with a lot of thoughts. So please, please, please don't be a stranger. Please reach out to me and let's continue to stay in touch.
Absolutely. And we do love our presenters to come back in a couple of months and give us an update. So we look forward to having you come back too.
Yes.
Next week is hybrid, is in person and virtual. So you could be the presenter
Yeah.
So I'm gonna have Ted speak to the rest of the slides.
So as you can see, we have a couple of slots. We definitely have one for next week in person. And then it looks like towards the end of October, we have another slot. So if you are interested in presenting, please reach out to us and we would love to have you. If you are interested in becoming an organizer and hanging out with the cool kids on Monday mornings to start the week, again, please reach out to us. It's a great time for us to gather, but to also kind of facilitate what we need to do to make sure that our Wednesday mornings go rather smoothly. And then we have our upcoming events. So we've changed things up a little bit on this slide. We do have a QR code that takes you straight to the Central Fairfax Chamber of Commerce events. So if you want to scan that, we do highlight some of them that are going on. We've got our weekly webinar from the SBDC. We've also got Nexco and the Fairfax Rotary. And then there's a couple of roundtables going on, but we also have our Veterans Growing America business that highlights, that's a pop-up that in the Woodbridge area. They have a networking event now on the last Thursday of the month. So that would be this week from 5 to 9. Every Friday they have an open mic from 6 to 8. And then on the weekends, they have veteran businesses in the pop-up. So we're gonna be shortly getting into the shopping season. So it'd be a great way for you to support local businesses, but more importantly, also support veterans and the veteran spouses. Next slide. So if you would follow us on social media and please share that with your fellow friends, family, and business owners. And you can easily do that by scanning the QR code and you will get all of our social media. We'd appreciate you following us. We'd like to thank you again for attending today and for the presentation that we had. We look forward to seeing you every Wednesday morning, or as many Wednesday mornings as you can join us.
Thank you. Great presentation, Ashley.
There you go.
Great.
Great job. Great job, Ashley.
Thanks, Mom. Thanks, Dad.